Hello you guys, welcome back to my channel P Life, the pharmacist life. Hello the P Life fam, how are you all doing? Welcome back, and we're just gonna go straight into today's topic. Today's topic is highly requested actually, and it is a topic that I actually love to share health and advice on this time of the year. So as we know, the weather is getting a lot better, you know, and as the weather is getting better, thankfully, and fingers crossed, the COVID virus will probably be suppressed a little bit. So it's getting warmer, even though we're at home being quarantined. But now, you know, the good sun can give us a good vibe inside our cells, give us a good vibe mentally, help, you know, increase that serotonin level, just help us feel good. So this is the time of the year when, you know, there are some things that comes with the nice weather, which is allergies, okay, like hay fever, bites, reactions to different things as well, like even reactions to like mosquitoes, honeybees, you know, different things. A lot of people are coming into the pharmacy asking, what can I do? I've got allergy symptoms, how can I sort it out? And here is why I'm doing this video. So for most of you that have requested this video, okay, here it is. This is my advice and tips to give you when you have the following things. So I'll probably do about 3 conditions, sort of, you know, 3 things that tends to happen a lot during the summer. So the first one is allergies, okay? Allergies it's like a reaction. It's a reaction. It could be a reaction to food. It could be a reaction to a bite. It could be a reaction to dust mites and house mites. It could be a reaction, like I said, to dust. It could be a reaction to quite a few things, you know. So if, you know, how can you identify what an allergy is? So basically, symptoms that you would get would probably be itching. So you get like a big rash, you know, come through your body, okay, and it's gonna be itchy. It's gonna be, you're gonna feel very edgy, you're gonna feel on edge, you're gonna feel unsettled, uncomfortable, and you could get that rash come up through. We call it hives, okay. The other thing, your breathing starts to change. You start to get different type of breathing, which means that, you know, the reaction is going really through your bloodstream, and it's affecting your respiratory organs, and so your breathing starts to feel quite funny, quite shallow, and that tells us that you're rapidly going into what we call an anaphylactic shock. So we really need to be careful with that. And if that happens, if you're someone that's got allergies, you should be aware that you should have a pen called an EpiPen with you. You need to be making sure that you hold that with you, because you need that when you feel like you're feeling faint, your breathing is going shallow, you feel like unconscious, or you feel like you're about to pass out. You need that EpiPen straight away. If you feel like your throat is closing up, like, you know, your tongue is swelling, your eyes are swelling, your nose is swelling, your lips are swelling, you need that EpiPen straight away. So those are like the allergic symptoms that you can, you know, you can kind of experience if you're going through an allergic response. You need to make sure this is the time of the year you have antihistamine tablets. So if you're someone that suffers from allergy and you were not aware of that, you know, leave me a comment, send me a message. I can, you know, direct you to more websites that can help you with that. So the next one we're going into is hay fever. Everyone, right now, this is the time of the year that we're all suffering from hay fever. Like, everybody is talking about hay fever right now, you know, that sort of thing. Even I am suffering from hay fever. I've got runny nose, I've got itchy eye, itchy throat, and I am so bad. Like, I don't know if anyone has seen my old video when I came out and said, who does this thing? And I'm gonna do it again. It's like this. I don't know if you guys can hear it. That's when you're scratching your throat. that's basically your throat is killing you. You feel like you need to scratch it. You know, you feel like you need to roll your tongue right on the roof of your mouth. Your ears are itchy. Your eyes are damn itchy. Your nose is runny. You're sneezing all the time. That's hay fever, you guys. And hay fever can also affect your breathing. And this is why we're always worried about people who suffer from asthma, because this is the time of the year that they probably will be using their inhalers more often, because they get more asthma symptoms. The airways in their lungs, you know, starts to close up. They feel tightness in the chest, and they need to use one of the inhalers that we call salbutamol, which is a Ventolin inhaler. It opens the airways. It helps open up your airways so you can breathe better. So this is the time of the year that we always recommend products for the eyes, products for the nose, antihistamine tablets that you can take to help you systemically to reduce those histamine release that is causing all those symptoms. You probably would know popular ones that they call allergy relief or hay fever tablets, you know, loratadine, cetirizine. Those are the ones that you can buy. Benadryl is another one that you can buy over the counter. And then obviously we have the eye drops, which is we call sodium chromoglycate, and that helps the, you know, histamine release that is happening in the eye, and just reduces all that allergic redness, soreness, itching. It just takes it down so you can feel a lot better. A lot of people also during hay fever tend to have a lot of skin irritations. Their skin just starts, they feel like their whole body is just itching them. Like maybe if they go for a walk, they notice that their body is just so itchy. That is also from hay fever. And I would say this is the time of the year, you guys, that you should be very conscious of your triggers. Like what triggers your allergy? What triggers your hay fever? What is it? Is it when you're in this certain type of tree? Say for example, you know, trees that release a lot more pollens than the others? Is it when you go to the lakeside? Is it when you go into the woods? When the weatherman or the weather woman is talking, he or she tends to talk about if there's going to be a high pollen count in the air. So if you're someone that really suffers from bad hay fever and you also are prone to having asthmatic attacks, you need to be, you know, keeping your eye out, watching that you are not going out during the times when the pollen numbers are high. Also try and not open your windows during those times as well, because you're allowing those pollens to come in, and then you have an allergic, you know, reaction. You notice that you're sneezing every day, you're sneezing in the house all the time, and you don't know why. It's because you open the windows during the times when the pollen count is high, and now you're struggling with it. Okay, I hope I've given a bit of content and value there. If you don't know the products that you need, comment below or send me a message. I can help you, but it's all like the same global products. Allergy tablets, allergy eye drops, nasal sprays are normally like steroids, just to help release the inflammation in the nose so you can breathe better. And that's what mainly those are. Would be bites. Bites is always very, some of them are very alarming at this time of the year. This time of the year, I'm like, I see a bite, I'm like, what did you get bitten from? Like, how? You know, how? You know, people coming into the pharmacy and saying, can I speak to the pharmacist? And they show this big, massive, like, reaction from a bite that is this little. And obviously, it's the time of the year when we get bitten a lot. There is all sorts of insect bites that, you know, you can react so badly to. They can make you feel really, really awful. You can have that heat around the site of where you've been bitten. It can be really itchy and aggressive, you know, very swollen as well. This is the time of the year, you guys, so you need to be careful. If you have a dog, if you have an animal that you take in the woods a lot, you need to be careful at this time of the year. If you walk in grasses, if you're walking in grasses a lot, this is the time of the year to be careful, because you can get tick bites, and when they latch onto humans, it is possible for you to get Lyme's disease, and you don't want that. That's good content right there. That's a very good tip right there. If you have a general insect bite, the first thing you want to do is put an antihistamine cream on it. Okay, and sometimes some antihistamine cream contains an antisteroid, which will help relieve the inflammation, reduce the inflammation, relieve that pressure that is there, and then within 2-3 days it starts to shrink, and then it can go to normal. Sometimes some people, they react quite badly to bites. They would have to take antihistamine tablet and use the cream as well. Okay, so that's something that you can buy over the counter in a pharmacy. The other thing that you can use, depending on what you were bitten by, like a spider bite. With a spider bite, it spreads really quickly. It literally gives pus and it can peel the skin off. With that, you actually need antibiotics for that one. You need to see your doctor very quickly, and you need to get antibiotics for that one. You can maybe manage it with a little bit of a cream, antihistamine cream, but you would need your doctors to get stronger medication. With a tick bite, same as well. That one you need your doctors, because nothing over in a pharmacy that is prescribable. Depending on the country you're in, some countries you can actually have access to most of these creams and most of these drugs. Some of them you can. So depending on the country you're in, if you're in a country where the regulations are so tight, i.e. here in the UK or America or Europe, you know, you would have to see your doctor to be able to get some antibiotic cream or antibiotic tablet. If you live somewhere in another country where the restrictions are a bit less and you can get those, definitely do that. Go for it. It's fine. Hopefully the pharmacist or the health person over there would be able to help you and give you the right things that you need. So guys, that's literally my summer tip that I wanted to share with you. If you want me to give more information or do another video going into, i.e. the types of inhalers that you can use at this time of the year, comment below, let me know. I will do another video in terms of knowing what type of inhalers to use depending on your symptoms, depending on how you're feeling, and that would probably be a good one for you. Any other health topics that's really on your mind that you want me to share, let me know. This channel is here to help and give advice, health advice on topics that I know would be very useful. So definitely send me a message if you need any help on any health topic. I could do a video which will benefit everybody. Make sure you like, comment, like I said, leave me a comment, and also share with your friends and family. Tell everyone about the P Life family. Tell everyone about Elizabeth. Let them also get good value on their health. How, you know, I can be of good help to them as well. Thank you so much for watching. I hope you've gotten good content and value from this. I see you next week on my channel with another health topic. Take care. Have a good week. Have a good evening. Lots of love from me. Bye bye.